All right. Today on the podcast, I have Courtney and Brett, the co-owners of BodyFX Sports Recovery and Rehab in Melbourne, Florida. Brett is a DPT of 10 plus years, and Courtney is a PTA of 8 plus years. They have a hybrid physical therapy and sports recovery clinic that they are going to tell us all about today. So, hey guys, welcome to the podcast.
Hey, thank you so much for having us.
Thanks for having us.
Yeah. So we've talked I was thinking, just give a little context, I've interviewed some other, like gym owners and Pilates owners, and I'd love to hear, just talk about you guys and what you do at your business, because I think, at some point, everybody probably needs your services. And so I'd love to dive into your area of expertise, but maybe can you start with like, how did you guys get started? How did BodyFX get started? Just kind of hear your stories behind the clinic.
Yeah, we started at the very end of 2020. In the middle of the pandemic, decided to start a new business, but luckily hands-on new business. But we started in the loft of CrossFit Own It, just 2 treatment tables and just treating people, doing just a lot more hands-on type stuff. And we were there for a little bit over a year. And then grew. Thankfully, we grew, and so we found a new location and added the sports recovery side that we have as well now, like with the cold plunges, the infrared sauna. We've got like Normatec compression therapy. So we've got like you said, the hybrid physical therapy that Brett and I do, but then we also have the sports recovery services as well. And that's been since March 2022. So we've only had that for a little over a year and a half, and we just keep growing. So it's been great. But yeah, so we're still relatively new, small business, coming up on our 3 years, I guess, the end of the year.
That's awesome.
I came on board, about a year after you started?
A little over a year after.
Basically through a mutual friend that I've known since high school that she goes to the CrossFit Own It with, and kind of just all worked out to where Courtney and I got together and had this vision of moving from the loft to a brick and mortar and expanding our ideas. So like you say, we've been therapists for a long time, and we wanted to, our goal was always kind of do our own thing, and now we get to do that. And it's been great to see the support and the growth that we've been able to accomplish.
That's awesome.
Sure.
Even I was gonna say, even before I connected with you guys, I had heard about, your location, and just, I could definitely tell there was momentum, building behind, your clients and patients, everybody coming in there. So what would you say is different? I think you had written in your bio, you both were in outpatient clinics, but realized you wanted to do more with your skills and knowledge. What maybe is different? Like if somebody has an injury or maybe and is going to go get PT somewhere, what's different about what you guys do versus like an outpatient clinic where they might, get sent by their doctor?
Right. So the biggest difference with us, besides the fact that we don't take insurance, but the biggest difference is that you're going to get one-on-one hands-on with us versus a traditional PT clinic. Not all of them, but most of them now, you're like the one therapist is seeing 2 or 3 people at the same time that they're seeing you. So we just wanted to, that's why we wanted to start our own thing, is spend more time with each individual patient. We have that skill set of the hands-on. So we do a lot more hands-on work with our patients as well. So that's what's just a little bit different. Like we still are obviously doing therapy. We're obviously doing exercises and manual treatment. It's just more individualized, more attention, basically just giving better patient care. I don't know about him, but at the very end of before I started this in 2020, I was seeing like 16 to 18 patients a day, and spending only 10 to 15 minutes of hands-on with them. And the hands-on skill is what you can't do that at home on your own. Like you can do those exercises at home on your own, but I think that's just such a big important part of it. And we're able to give that to our patients, is that one-on-one care.
Yeah, that's awesome. That's awesome.
Yeah.
I know I've worked with a PT before, and same thing. It was one-on-one, was one-on-one. She didn't take insurance. But somebody who works with moms, you know, postpartum stuff like that, but she was able to assess something in my body that nobody else has ever picked up before. And it's like in my hips and affects my gait and all kinds of things. And I thought, yeah, if we were doing a quick, you know, 10-minute, you know, oh, here, okay, do these exercises, like that she wouldn't have picked up on it probably.
Right. Just that, yeah, you get to spend more time, so you get to assess longer and maybe find some things that others haven't.
We get a lot of that feedback, people telling us like, wow, nobody ever looked at that before and connected those dots or whatever. So it's pretty gratifying to hear people that have gone to potentially multiple other places and then they come here and then they get better. So
that's awesome.
Pretty awesome.
Yeah. So Brett, what's
sorry.
Go ahead. No, you go ahead.
When Courtney mentioned hands-on, we keep saying hands-on, you know, we consider it manual therapy. It's basically, like Courtney said, it's skills that you're not going to be able to do by yourself at home. So that's going to be soft tissue work. That's going to be the Graston that we do, which is like the scraping tools, cupping, joint mobilizations. As we're going, we're assessing and we're giving people feedback on what they can be doing on all those hours that they're not here with us, like on our treatment table. And we emphasize that, yes, the hands-on stuff feels good, but the homework is just as, if not more, important to the whole equation. So that's kind of our philosophy in what we do. But the fact that we get to spend a full hour one-on-one with people, I think makes a huge difference in outcome and satisfaction.
Oh, I bet. So what types of patients or clients do you see? Or are you seeing all kinds, you know, are there injuries? Are they post-surgery? What's your typical patient who comes to you?
We kind of get all over. You know, we kind of started in the CrossFit gym. So we were getting just kind of a lot of CrossFit athletes, just obviously having that built-in member base right there with them. But since being in our own brick and mortar, we're getting a lot more, you know, just weekend warriors, people that are active and they want to stay active, or it's not, we have surgical patients, we have post-op patients. A lot of those typically they want to go through their insurance, so we don't get as many of them, but we get, you know, we've had as young as 8, 9, and we've had as old as the 80 probably in here. So it's just, we get everybody, we treat everybody. We're still traditional, like PT, orthopedic PT. It's just, it's a lot more people that I feel like actually want to get better, and they have a drive to get better and actually get back to doing whatever they aren't able to do because of injury. We also get a lot of people that just come for maintenance, you know, like they don't have an injury, they don't really have pain, but they work out a lot. So they just need this kind of routine body work or this routine maintenance just to keep healthy and to keep from getting injured. So we kind of see it as like preventative maintenance as well.
And I would say that's our goal with the majority of our patients, is to get them to that point where they come in, and I like to compare it to like getting your oil change or getting your tires rotated. You know, it's staying ahead of the pain, it's staying ahead of the problems. And that's like our ultimate goal with everybody. I tell them, I don't want you dependent on me. I want you to be coming in proactively, maybe once a month, you know, to stay on top of it. So that's kind of, we don't like to like just treat pain. We like to like get ahead of it and give that like long-term plan.
Yeah, sure.
Yeah. Oh, that's awesome. That's awesome. Yes. I could see that, your clients are definitely going to be the more, not necessarily somebody who's in chronic pain and, you know, I don't mean that in a negative way, but you know, somebody who, like you said, is not as proactive about their health, is probably not coming in to see you guys. So we kind of talked the PT side of things. So what is the sports recovery side of things look like?
Yeah, so we have, like I mentioned at the beginning, we have 3 cold plunges, we have an infrared sauna, and then we have the Normatec compression therapy, which is just like you have these leg boots or arm sleeves that have a sequential pressure with air that just kind of helps lymphatic drainage. You know, if you have any fluid sitting in your extremities, it just kind of helps get that moving and out of your moving through your body better, so it's not just stagnant, you know, sitting there. But we are membership based with that, so for $70 a month, people can come in once a day. We're open 6 days a week. They can come in and use any of those 3 things as however they'd like. So a lot of people will do, you know, like a cold plunge, you know, 4 or 5 minute cold plunge, and then they'll get an infrared sauna to do contrast therapy, and then they'll get back in the cold plunge. And basically, again, set up membership base. You just kind of come in, do your own thing for 45 minutes in whatever order you want, and then you're out, you know. And it's just kind of on that same thing as preventative. You know, people that are coming in doing that pretty consistently, we find that we don't really treat them very much either. You know, we'll see them occasionally if they have something they've tweaked, but the people that are coming in for recovery things are people that are just really trying to stay ahead of that, staying ahead of any injuries they might have from being active. Or we even have, there's a lot of research on cold plunging for hormonal benefits. So, you know, improves sleep, decreased stress, helps boost serotonin. You get that dopamine, that norepinephrine release after doing a cold plunge. So even more than just, you know, musculoskeletal recovery, it can be really, really good for hormonal benefits as well.
Yeah, that's what I was gonna say. So if somebody isn't familiar with that stuff, like what would be, because it's very, you know I have so many friends too who are like, but you know, trying to go like live in different areas. I have a friend that, you know, has their own cold plunge and stuff now. But what if somebody is not familiar? Yeah, what would be the benefit of that or versus the sauna? And I saw I got the email. You guys got a new sauna recently, right?
Yeah, we just got a brand new sauna, brand new infrared sauna. So
awesome.
Get that together last week. But yeah, I mean, there's benefits to just plunging in itself. You get obviously muscle relief. Like there's going to be lactic acid reduction. There's going to be increased blood flow. Blood flow is healing, and you know, there's benefits to your immune system. You know, when you get in a cold water, your liver produces what's called cold shock proteins, and these proteins go in your bloodstream and they basically seek out free radicals. They seek out oxidants in your body, and which those are the bad things. And these cold shock proteins basically eat those cells, and the byproduct of that is heat, right? So you're actually warming your body back up, but at the same time you're getting a huge immune system boost. So it's pretty awesome, just the fact that we got in at this time, because this is obviously becoming very popular through social media and whatnot. There's lots of big names out there that are talking about cold plunging now, and just to see the research that's coming along with it, it's not a fad. You know, like there's real science to say that there is a lot of multifactorial benefits to plunging, doing the contrast, and just kind of doing that preventative recovery.
What's the benefit with the contrast, like going from the cold to heat? And
I would say that you get you do a cold plunge and you kind of flush your system initially because the cold is vasodilating or constricting those blood vessels. But then you go in the sauna, it promotes healing, promotes blood flow, maybe bringing nutrients to an area to promote that healing. Also just being in the infrared rays so we did infrared versus a dry sauna. It actually penetrates deeper into your tissues to allow that blood flow, allow nutrients to get to the area. Infrared is really good for cardiovascular health. It's really good for even like your skin. So people, you know, you may not sweat as much with an infrared, but it actually like it's going deeper into your tissues for that healing. But with the contrast, you get that initial flush, then it promotes healing by getting in the warm, and then you go back and get cold again, because the benefit is to let your body naturally warm itself up for you know, that immune boost, or even that brown fat, which the cold stimulates that brown fat, which can help with weight loss and metabolism.
I would say beyond that,
so like everybody
yeah,
everybody should want to come do
you don't have to be a superstar athlete to be coming in here and benefiting from the plunge, sauna, or you know, combination thereof. I think with the contrast, a lot of it is like the pumping mechanism that happens in your cells. When you go from cold to heat to cold, you're getting like a pumping mechanism, and it helps to flush out toxins and lactic acid, and this really promotes that circulation effect, which we all know blood flow is healing, you know. So people need that. So yeah.
Got it. Awesome. So if somebody is local, you know, where are you guys located, and how, you know, do they get in touch with you, things like that?
Yeah,
Of
so
course, we're doing all kinds of stuff, but
yeah, we are kind of right in the middle of Melbourne. Honestly, we're very, very close to Melbourne Square Mall, just east of Melbourne Square Mall. If you know where, like, on 192, there's a Crunch Fitness there. We're kind of tucked behind them down one of those little side streets. So we're down there in right in the middle of Melbourne, but we also offer the first recovery visit free. So if they ever want to just come try out the cold plunge and try out the sauna, they're not sure if they want to be a paying member, you know, they can come try it. We'll walk them through everything. You know, whatever they need to do, we'll kind of walk them through it, tell them there's always somebody here, and give them the best, I guess, spiel we can at explaining it. The first time, it's not fun. I'm not going to sit here and say that cold plunging is super fun, but the way you feel afterwards is so beneficial. Like, I personally, myself, everybody does cold plunging for different reasons. Like he said, you know, it's not just for muscle recovery, or I personally like to do it like mid-afternoon, because I'm here till about 7:30 at night most nights. And so it just gives me like an afternoon energy boost, you know, to get me through the rest of the day. I just feel like awake and ready to go because of that dopamine, that norepinephrine release. And so it just depends on, I guess, your goal and all that kind of stuff. So
definitely.
Sorry.
Is there anybody who like shouldn't do cold plunging or the sauna? Like, would there be anybody who, you know, any contraindications, I guess?
Yeah, I would say there's not like hard contraindications. I don't think, you know, red flags. There may be some yellow flags, like if you have probably any kind of venous insufficiency, which is where like your heart's not able to keep up with the fluid return and like that lymphedema system. I think it,
like if someone had lymphedema.
But on the other side of it, it could like benefit it because it's helping kind of get some of that out of there. So I don't think it's necessarily a hard red contraindication as much as it's just like, we'd ask to talk to your doctor before doing it, you know, get clearance if you have any kind of heart issues, because getting in the cold, like, it's literally going to take your breath away for a second and kind of shock you. And so if anybody has any heart conditions or something like that, we would definitely want something from their doctor. But if the doctor says it's okay, I really don't think.
We haven't found any like true contraindications. Obviously, like open wounds, things like that. You wouldn't want to but I'd say cardiovascular is probably the biggest like flag that we kind of look for, and we do have like a little screening waiver that we have people fill out to make sure, like, hey, are you healthy, fit to hop in a cold body of water? So.
Well, and this one might be obvious, but just because I did a little talk with Fit for Mom, and they have some pregnant mamas. So I'm assuming if someone is pregnant, they probably should not be doing cold plunge or sauna.
That's again, I think it's still a yellow flag.
Really?
Getting it from your doctor. I think maybe in either very early first trimester or very late third trimester, it's probably not okay, but it, you know, could trigger possibly something early or early labor. But I've definitely, we had somebody ask about it, and we just said the same thing, you know, we've read that there's really not, like, some can, some do, but you just want to talk to your doctor. It's kind of doctor specific. So luckily we've never run into any issues, like, knock on wood, but we've only had a handful of people that we say, well, you know, definitely check with your doctor first. But again, it's not any big red flags that we know of.
Yeah, got it. Interesting. Okay, cool. I feel like we should have asked this in the beginning, but tell me just like a little bit about, you know, you said you guys kind of met through a mutual friend, you know, but are you both from the area, or where are you from? Just like a little bit about who you guys are personally.
So I moved to Florida when I was 2, specifically to Palm Bay. So I grew up here in Brevard County. I went to Satellite High School and basically played soccer my entire life here, and active surfing and boating and all that fun stuff that we do here. And, I did my undergraduate at University of Florida, and then PT school up in St. Augustine. So I've pretty much stuck around Florida my whole life, and ended up back here working in downtown Melbourne for about 8 years. And basically in between jobs is how I ended up meeting up with Courtney, like I said, through that mutual friend. And yeah, the rest is kind of history. I'm married. I have two little ones. They're 5 and 4 years old, and yeah,
Oh,
they keep me busy between being a business owner and having two kids. And my wife is also a business owner, so
oh,
we
wow.
we stay extremely busy. So
I guess so. I understand. Mine are a little smaller, but I understand that little kid life.
yep.
Then I'm actually originally from Indiana, was born and raised in Indianapolis, but I moved down here about 8 years ago now. My last internship for PTA school was down here in Melbourne, and then I got offered the job after I graduated, and I said, I think I'll take hurricane over snow, because we don't always get hurricanes in Florida, but they always get snow in Indiana. So I've been down here for about 8 years now. I was in a traditional physical therapy setting for, I guess, the first 5 years that I was down here, and I do CrossFit for fun. I've been a coach at the CrossFit gym at CrossFit Own It for about 7 of the 8 years that I've been down here. So I've been doing that for a while. And I don't have any kids, but I have a dog, and she keeps me plenty busy. So
What kind of dog?
I don't know how you guys with kids do it, because she's a lot and she's just a dog. But she's a Basenji. I don't know if you've heard of your dog before. They're the barkless hound. So she doesn't bark. She's very quiet, but she's very, very stubborn, and everything is on her terms. So, but she's good. But yeah, so stay busy running the business and working out, doing CrossFit.
I bet.
Taking care of her. So.
Well, and you guys are still, your location is still pretty close to Own It, right? Because they're kind of like a couple streets down from you
It's
guys.
actually literally just one street behind us.
Oh, one street.
Yeah,
Okay.
there's a little ditch that we sometimes, like, people from the gym will come over and just take that. They'll just walk right over, or we'll walk over there. So it's very close. So it's just one street over, and then we can literally see the back parking lot of Crunch, like, fitness too. So we're kind of sandwiched between two gyms, which is very convenient. So
yeah, nice and great placement for you guys. So awesome. Well, guys, thank you so much. This has been awesome. Just learning all about the different modalities. And so I've got here, they can check out your website at bodyfxmelbourne.com. You're also at BodyFX Melbourne on Instagram and Facebook. And what is the best way? So if somebody does want to come in, do they just go to the website to do the free trial? Do they need to make an appointment? How does that work?
Yeah, so we do request that you make an appointment, and you can certainly walk in and just check out the facility at any time. But we do try to keep that schedule pretty, I won't say strict, but we try to keep it, organized throughout the day. And you can go on the website. There's also an app through Square that you can go on and make an appointment through there. It's pretty straightforward through our website to sign up for the free trial, but you can always send us an email, Instagram message. We have direct phone line to our cell phones as well. So it's pretty easy to contact us and get started.
Perfect. I know we have to come in. We had ours scheduled, and then I want to say my husband has been on night shift, and I think that screwed us up. I think I scheduled an appointment when he was going to be sleeping. Yeah, he should be sleeping. And I realized, like, oh, let's wait till we can figure that out. We have to come in one evening when we've got somebody to watch the kiddos. So
for sure. Yeah, absolutely. Fine.
Yeah. Well, thank you guys so much. We'll talk to you soon.
Thanks for having us.
Thank you. Appreciate you.